It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. Some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. Every day, everyone wanna hear from Sandra. 'Cause every day, everyone got to hear from Sandra. 'Cause every day, everyone got to hear from Sandra.
Good morning, good morning, good morning, everyone. Happy Tuesday, K-Man. Hope that you guys are doing fantabulous. I was looking just now at the slides for this morning, menopause, and I forgot that we're no longer in the month of November. So I was thinking for a second there, yeah, that's a good play in words, menopause. And then I went, wait a minute. No, this is the one for us ladies. But you men need to listen as well, because trust me, undoubtedly there's some nuggets in here for you. All right, you guys know what time it is. It is Tuesday morning, so we are ready for Medical Rundown Tuesdays with Shamari Scott and his team. I think that we're just waiting on one more person who was in the wrong studio, a little bit of mix up there this morning, so they'll be jumping on in just a second. But in the meantime, I feel like Shamari has some updates for us. So let's go ahead and pull him into the studio. Good morning, sir. Good morning.
Good morning, Sandy. How are you doing?
Smile on your face. Something positive
Let
happened.
me adjust my camera.
No
Yes.
problem. Tell
I have
us.
to adjust my camera because, you know, since we've got rid of Mr. Greer, we're now 3-0.
Oh my gosh.
So we've won 3 games in a row since sacking the GM. So I don't know what's going on.
You got to think this is a bit of a setup where the players just him.
I don't know. I guess all the stars are aligning. I mean, most people would say, you know, the chances of us getting in the playoffs at this point in time were like 0. But the fact that we keep winning, if we keep winning, we might actually squeak in if we win out. So, you know what? I'm like, all right, that's fine. Keep winning. Just keep winning. Playing well, keep winning. And whomever the new GM is in the off season, then we'll give him something to work with, right? So, I mean, the players are auditioning as well, right? With a new general manager, if you don't play well, they may choose to go in a different direction when the GM is hired in the off season, right? So I'm sure every player is like, all right, time to pull up our socks and show that we belong to be on this team, and we're going to fight to the very end. So amazingly,
Pressure's
so
on.
we're 3-0 since Greer lost. Since we got rid of Greer. So yeah, so last week we had a bye, and this week we came back with a vengeance and actually won again. So it's amazing. Happy times in Dolphin Land. Happy times. Now, my Lakers, on the other hand, had a really big winning streak. We were 11-2 in the month of November, but then last night we dropped one. We're still doing very well compared to where expectations were at the beginning of the season. I think they thought we would be okay, but we're actually one of the better teams in the league. So, a little bit of a heartbreak last night, but it's still early in the season and we're looking good. So Dolphins are doing much better and Lakers are doing great. So all is well in Sportsville when it comes to the Scott household.
Beautiful, beautiful. Now, did you get to see Shaq's daughter who was here? Did you get to see her play?
I did not get to see Shaq's daughter, but I heard it was amazing. Heard the tournament was amazing. A lot of quality basketball. Well, based on the teams that are here, you're going to get quality basketball. But I know some people who would have gotten to see her and got pictures, and not only her, with some of the other notable players as well. So that was amazing. It's amazing that we're able to bring such a high quality tournament to the Cayman Islands, and our youth, especially us old dogs, our time has passed us, but our youth to be able to see that type of basketball, and for those that aspire to first understand that you need to get your grades to be able to get into a great school in order to chase your dreams. So it's always good for players to see, that level of basketball right in front of them,
All right. Very, very good. So we're still waiting on our physician to just jump on here. Let me just make sure. But yeah, no, that sounds fantastic.
Let me introduce. So you rightfully so. We're talking about menopause, and it's an area that I've found that when doing the research, that a lot of women don't seem to know a lot about. Now you'll have some that research it themselves, and even though they're going to doctors and such, in general, obviously when women are younger, I guess their mothers are talking to them more and such, so they understand those stages even without a doctor. But for the most part, there are a lot of women who don't quite understand menopause. And what I also found out recently, and maybe that's another topic, that men go into menopause as well.
Yes. That's why initially I thought this might have been that conversation.
For another day, but I found that out recently that I was a little bit blown away by. But I know Dr. Aditi will be joining us shortly, and she's our internist. So she's one of our specialists in the internal medicine field. She has close to a decade of experience. She trained at the premier institutions when it comes to internal medicine, comes to endocrinology. She combines evidence-based clinical practice with a patient-first approach. So kind of a GP, but specialized at looking at the management of metabolic and hormonal disorders, diabetes, thyroid conditions, endocrine-related conditions, also infectious disease, and preventative medicine, which is also important in today's world where we're trying to make sure that we understand that people are living their healthiest lives so that we don't have a lot of the, loss of life, as well as, the quality of life later, as well as costs that come along with it. So she's also an expert when it comes to preventative medicine as well. Now, I am going to check to see if she is joining.
Yes.
She's here. All right, perfect. As we got that second link.
All right. Good morning. Good morning. How are you?
Everyone. Hi.
Good morning. Good morning. Thank you so much for joining us. So Shamari rightfully says that, I'm at that stage now where I'm here also thinking about menopause, wondering, is this it? Have we started? What's going on? How does this work? So I think that you're going to be an extremely welcome guest here today from the perspective that myself and a lot of my friends are at that age now. We're in our early 50s and we want to know how this is going to work. So it's an exciting time. Like I'm ready for it. I mean, I don't know about anybody else, but I've got tons of questions. And
Yes.
so let's go ahead and go through it. So welcome to the program. I know that Health City continues to build out their staff, particularly around women's health. And the women's health area has multiple physicians now that are there and ready to, speak to young girls as young as 9, because things start early these days, all the way through straight past menopause. So let's get into it. So the first question I think a lot of women ask is, what is menopause?
So basically, menopause, it is not like just one particular incident or, one particular thing what you come with. It's not like how you come with like a fever of so many days. Menopause is basically a phase. It is a physiological phase in any woman's life. Now, it's widely, I would say, misunderstood, under discussed, because the information out there is a lot of information, but again, it's misunderstood. It is basically a
Mhm,
biological stage where there is a menstruation, a stop in the permanent stop in the menstruation. But it does not happen overnight. Usually,
mhm,
we say if a woman does not have menstrual cycles for 12 months continuously, then we term it as menopause.
mhm,
But speaking about menopause, more than menopause, it is the perimenopausal symptoms. It starts
mhm,
way before. So somebody might still be having regular menstrual cycles, but they might
mhm,
have already started experiencing perimenopausal symptoms.
mhm.
So that is
Okay.
actually the beginning of it, when you are
Yes.
having your menstrual cycles, but you have also started developing few symptoms, perimenopausal symptoms.
All
So the
right.
thing is, many do not understand, because they're having their menstrual cycles. They do not understand that, okay, the symptoms probably are because of the perimenopause.
Mhm. Okay, we're going to go through some of those this morning, no doubt. And it's kind of interesting because apparently there are some women who kind of go through it and don't even know that they're going through it. So this is where
Exactly.
a lot of our questions are
Exactly.
going to be. And I guess maybe I'm going to put myself in that category. Maybe we are the lucky ones. I'm not really sure. So let us, you know, ask the first question that a lot of women want to know. How do you know that you began perimenopause?
Okay. So few of the common symptoms. One is the age. So anywhere between 45 to 55 is the common age where you can expect to develop these symptoms.
Mm-hmm.
But there is also something called as early menopause, where few women might develop the symptoms as early as 40 years of age. So 45 to 55 is the common one, but you can develop few symptoms as early as 40. Not very common though, but of course it's been noticed in few women. Now, again, it is not one size fits everybody. So, the common symptoms, let me start with. One is heavier and less frequent periods.
Mm-hmm.
So, if you if you're somebody who's been having regular menstrual cycles for years together, and then without any reason, you're not on any medications, any hormonal pills, you just start noticing that your periods are getting less frequent and they're heavier.
Mm-hmm.
Other common side effects, which many of them identify actually, are hot flushes in the day and night sweats, disturbed sleep during night. So these are usually the common symptoms what patients present to us with. Rest of them, it goes on as the time passes, like brain fog, mood swings, drop in libido, vaginal dryness, discomfort
Mm-hmm.
during sex, and weight gain.
Mm,
So these are, the list goes on actually, because different
that's
women
right.
present with different symptoms.
Yes.
So yeah.
All right. So what is the normal age of perimenopause for, I know, everybody can be a little bit different in terms of this, but is there an age that you can expect it to start to manifest itself?
Yes, I would say 45 plus. So around 44, 45, or after that is usually the most common age where people start experiencing these symptoms. Now,
Mm-hmm,
again, it comes very slowly.
mm-hmm,
So you might not even realize, especially things like mood swings, sleep disturbance. Most of the times we relate it to, other issues like stress, work stress, or something like that. But it can be because of the perimenopause as well. So, which is why if you're constantly having these symptoms for say more than 1 month, 2 months, 3 months, it's going on, then I think it's the right time for you to go see your doctor and understand what is the symptoms because of. Is it because of perimenopause or is it something else?
hmm. Okay. All right. And if you're sitting here, like me, and you're 50, I think I'm 52. I have to double check. And I don't really know that any of this has happened. Is that normal? Because I'm sitting here going, I think just because of my age, maybe a few little irregular cycles, but nothing else. Could that just be it for me? I mean, I don't know. I'm confused.
Yes. Again, so we'll have to take a detailed history and do an evaluation
Uh huh.
because not everybody will have these florid symptoms.
Mm, okay.
Okay, so you can see that 1 in 4 women will have extreme symptoms like recurrent urinary tract infections, vaginal dryness, absolutely sleep disturbance, mood swings, and all these things. So that is like the worst of it. But a lot of them, a majority of them, will have minor symptoms. So just few irregular menstrual cycles. That is how it starts.
Mm-hmm.
So that might be the very beginning of perimenopause.
Okay. Hmm. All right. 9362626. Again, I guess the transition can be slow for some of us. And is it possible that you have little to no symptoms and it just happens?
Yes, of course.
Yes. Okay. Well, that we're hoping for that scenario. We are here for that. Okay, so the transition lasts for a couple years. Some people I do know really, really suffer with a lot of symptoms. So, I've got a cousin and she lives abroad, and my goodness, hers was kind of onset because of I think a hysterectomy or partial hysterectomy or something. So, she's had it very, very early and it has hit extremely hard. Is it the case that if you have gone through certain surgeries, such as a hysterectomy, that it will throw you into perimenopause and menopause in a very different way than if your body kind of naturally goes through it?
Yes. So especially if you've undergone hysterectomy with removal of your ovaries. Okay,
Mm-hmm.
because ovaries are the ones which are producing these hormones. So
Oh,
for certain medical conditions, sometimes it might be necessary that people undergo these surgeries at an early age.
yeah.
So that is called like a surgical menopause, where because you have lost your organs, the hormonal phase, what you see during menopause, occurs early in life.
Uh-huh.
So
I
that
see.
is possible, and because it happens suddenly, correct? Here, the loss of hormones is gradual in the natural menopause, but if
Mm-hmm.
it is surgical, then it happens all of a sudden. So that might uh, pose these problems where your symptoms as well are extreme and it happens all of a sudden like abrupt onset of symptoms.
Mm-hmm.
So
Oh,
yes.
okay. All right. We got some comments and stuff coming in already from our ladies. Good morning, Miss Bonnie. Welcome to the program. Barbara, good morning. Pleasant good morning to Evelyn. Evelyn says that going to the doctor doesn't help. Oh my goodness. I went to the doctor and it didn't help. I had was to do my research and deal with it the best way, the best based on the research, took my vitamins and exercise. So we're going to talk about, what treatments are available here. But do you find, generally speaking, that a lot of women go through this kind of silently, like they don't talk about it? They feel like physicians aren't really helping them in any way?
Yes, that is again because, like I said, a lot of them are not aware that they are going through the menopause or perimenopause. So the symptoms as such. So if you come early, it is better. So the earlier you come at the beginning of it, and it is not only hormone replacement therapies. There are definitely a lot of general things which can be done. General lifestyle, health measures to take care of your sleep, and you can just go symptomatic, like as and when you get symptoms it can be dealt with. So when, like you said, when people have minimal symptoms, some might have just very minimal symptoms, even they can come to the doctor. We can treat exclusively for your symptoms, not necessary that every patient requires a hormone replacement therapy.
Mhm.
So most of the time we do based on individual, a lot of factors has to be taken care of. So your risk factors, your personal history, family history, what kind of work you are doing, what are your symptoms, and what are the expectations. Again, though there are treatment available, we need to see which one suits you the best.
Mhm.
Okay, so sometimes we might not even advise hormone replacement therapy for certain type of patients if we see that they have certain risk factors. So it is always outweighing the benefit versus the risk, and that is why individualized treatment works better.
Mhm. Hmm. All right. So everybody's impacted a little bit differently. Irvlin says that I will. I'm here. Will want to introduce you to hormone replacement. So I don't believe in hormone pills, and she started at age 50. So we'll get to hormone replacement here in a question, but in a minute. Sorry, as a question. But folks, if you have a question, can feel free to give us a call at 936-2626. I guess the bottom line here is you got to recognize some of the signs for what they are, and also, don't be shy about having this conversation, because I suspect that, most women will have some of these symptoms, if not all, to varying degrees. So the physical symptoms can include a hot flash. Can you define what a hot flash is? What does it look
So
like?
yeah,
Mhm.
so hot flash basically, even if you're suppose sitting in an AC room, you can develop an episode where you start feeling extremely hot, flushed. Your skin might appear, flushed or reddish, and that is something discomforting. It might go on for a few seconds to minutes to hours. It is basically because of the deficiency of estrogen. So all these hormones are necessary to maintain the normal thermostat of our body, that is the temperature control. So
Mhm.
because of a lack or deficiency of these hormones, you start developing these hot flushes. And in the night, the same thing turns into night sweats, where a lot of people, they wake up from their sleep because they're drenched with sweat. It can go that extreme as well.
Mhm.
So again, I understand a lot of people have these, thing about hormone replacement therapy. They feel like it is something they do not want to go for. So it is not always systemic hormonal replacement therapy which is advised. For a lot of them, we have local application like vaginal creams. We have patches which are milder, and it will take care of your symptoms.
Mhm. In fact, we have someone here who says you just have to find the right doctor. I had symptoms for 19 years, then met a new doctor, and she put me in the patches. The difference is amazing. So, 19 years. How long? Let me ask this question. How long does this last? Is there such a thing as you're done with menopause?
So, there are patients who have experienced symptoms for decades.
Oh my Lord.
So, if untreated, usually it lasts for 8 to 10 years,
Uh-huh.
7 being the average in untreated cases.
Right.
And for some of them, even after you cross 60, they can have some symptoms, especially the vaginal dryness, recurrent urinary tract infections. Again, these can be sometimes missed,
Mm-hmm.
especially recurrent urinary tract infections can be missed, and not, especially if it's not correlated with your menopausal symptoms.
Right.
Can go on for decades, which is why it is important to diagnose early, start treating early, and go through the phase smoothly. You don't have to go through the menopausal transition with all these symptoms. It can go smoothly, and
Mm-hmm.
usually with medications within few years, we will be able to taper it and stop it.
Mm-hmm. All right. So we have a pretty broad list here of symptoms, not just some of the physical ones, such as the hot flashes, the night sweats, irregular and heavy periods during perimenopause, vaginal dryness and discomfort, even weight changes, reduced libido, joint aches, sleep disruptions, disturbances. We know that that can kind of throw you off in a lot of different ways, but also there's emotional and cognitive symptoms. And I thought some of these were interesting. So, mood swings, anxiety or irritability, brain fog, difficulty concentrating, low motivation or fatigue. So, some people might think, that these symptoms are occurring for different reasons, but they can also be part of the overall transition that a woman goes through.
Yes, that's absolutely correct. Because these symptoms can overlap with a lot of other medical conditions.
Mm-hmm.
Okay, if you see anxiety, irritability, mood swings, low motivation, concentration, this can happen because of other uh, psychological issues as well. So it is not extremely particular to menopause or perimenopause, which is why it is necessary to diagnose and get everything together, get the complete detailed history, and then correlate it. Only then you will be able to get the right treatment and go through it.
Mm-hmm. Hmm.
Because most of the symptoms can be, for a lot of people, it can be like very less physical symptoms and a lot of emotional symptoms.
Mm-hmm.
For few, it can also be the other way around. So
Yes.
like I said, recurrent urinary tract infections, that might be the only symptom for a lot of them, without any mood swings or emotional issues.
Mm-hmm. Hmm. All right. Long-term health changes, bone density loss, changes in cardiovascular risk, which is one that, obviously we should be very, very concerned about, and metabolic changes affecting cholesterol and blood sugar. So this then is why we see, I mean, we just say, oh, once you get middle age, these things start to happen. The body starts to fall apart in some respects. But this is why we see things like our blood sugar, we become more insulin resistant,
Yes.
the weight starts to pile on, which doesn't help all of these things. Our cholesterol starts to go up, our blood pressure starts to go up. So that's actually part of the menopausal and middle age. I suppose it all goes together. Um, Cycle for people. So you've got to work extra hard to keep those numbers in check.
Yes. So these are the long term effects. So when we speak about menopause, the short term effects are the physical symptoms, emotional symptoms, what we just discussed. So the bone changes, cardiovascular risk, cholesterol, blood sugars, all these are termed as long term risk factors because they do not go away immediately. You need to have, so when we do a health check for a woman, suppose somebody comes to us at the age of between 45 to 55 years of age. So keeping in mind the risk factors for fractures, bone health, we need to see if there is any risk of osteoporosis, make sure the bone health is taken care of, even the cardiovascular risk, the family history, and especially if you're around this perimenopausal area, it becomes extremely important that all these has to be looked into and followed up. Follow up is equally important because the bone health, cardiovascular risk, all these go on, decreasing with time.
Mhm. All right. So Irvlin says, Sandy, it's a very annoying feeling. Right now, I'm having an episode. I'm assuming she's referring to hot flashes. While at work, I just took up my bag yesterday and told my husband I need to go home. And how long do the hot flashes tend to last for?
So, see, this is one of like when these symptoms are causing trouble in your day to day life.
Mm-hmm.
Like she's at work presently, and she's having one of these episodes where she'll have to go back home from her work. This is the extent where it can affect your day to day life. The hot flushes, like I said, can last for few seconds to minutes, depending upon the severity.
Mm-hmm.
Am I
Okay.
audible?
Yeah, yes. Sorry. I think the audio kind of kicked out a little bit. So you said it can last from a few seconds to minutes?
Yes. For some
Mm-hmm.
people, it can go on for few hours as well. So, depending upon the severity and how frequently is this happening, it is important, that we plan a strategy. We have to see if she is somebody who requires medication or just lifestyle changes.
Mm-hmm. Okay. All right. So let's talk about Health City's menopause clinic and what this clinic is all about and what are some of the services that are available at the clinic.
Yes. So, like, we've been discussing that it is not just one particular symptom. It's not just related to gynecological. It has long-term medical issues. Menopause can have a lot of symptoms. It can affect your whole body, your heart, your bone. Overall health has to be looked into, which is why Health City has come up with something called as a menopause clinic, where
Mhm.
all the so it is basically something which is a comprehensive it provides comprehensive menopausal services. So we have brought together a team of specialists, which includes a physician, nutritionist, gynecologist. So a complete assessment of your menopause, starting with your symptoms, your past history, family history, investigations. Again, it can be tailored to every person based on all these things, and assessment of risk, not only for now but also for the future.
Mhm.
So these are few of the things which we will be concentrating on. It provides evidence based support. So we will cater every individual in a different way. We will chart out what are the
Mm.
investigations required. It will be assessed by a physician, followed by a gynecological consult if required, and then probably decide the medications. If somebody requires a hormone replacement therapy, that will be provided, follow up for the same, and also investigations and follow up for long term health of the women.
Mhm. Hmm. Okay. All right, folks. So there's help. There's help here for us as women. They've got the menopause clinic where you can have a full team of specialists available to support you through every stage of the transition, providing confidential, evidence-based, and compassionate care, supported by thorough investigations and personalized treatment plans. So there's no such thing as one plan for fits every single woman. It certainly depends on what your symptoms are and what you're going through. So, strong will, says Sandy, I have hot flashes for over 10 years and it's a horrible feeling. And again, the hot flashes, just like the menopause process, can last for quite some time. That's a
Really
question.
sorry,
Sorry.
Sandy is
Yeah.
experiencing hot flashes for 10 years. That's not easy. It's not at
Yeah.
all easy to, go on with your life having such symptoms for 10 long years. So
Mm-hmm.
I think definitely to be considered for further evaluation, and hormone replacement therapy will, I think, help Sandy, of course, considering the benefits versus the risk. Because, like I said, hot flushes is usually because of the estrogen deficiency. And
Mm-hmm.
simple things like estrogen patches, short term, can definitely help her tide over the hot flashes.
Mm-hmm. Okay. All right. And what is it? What's the treatment? Tell us how the treatment works when it comes to hot flashes in particular. The treatment that you will put women on, how does that help alleviate the hot flashes?
So we usually, so basically, other than the lifestyle changes, what we ask them to, follow certain steps so that their sleep is not disturbed. Certain components like vitamin deficiencies are treated, magnesium supplements are given, and of course, hormone replacement therapy. Here, the ideal thing would be an estrogen patch if the hot flashes are this regular, going on almost every day for 10
Mm-hmm.
years. Oral therapies are also available now, depending upon a lot of factors. If she has a uterus, risk for breast cancer, considering all these things, either estrogen only or estrogen plus progesterone, oral medications can be prescribed, or patches. So
Mm-hmm.
estrogen patches, when you use it, what happens, or like even the medications, there is a slow release of the estrogen hormone, which
Mm-hmm.
happens throughout the day, which is basically something which helps in tiding over these hot flashes. Now we start with a certain dose and increase or decrease it based on the relief what every patient, uh, you know, the outcome of it, and it can be tapered over few months or years based on the symptoms and stopped eventually.
Mm-hmm. Okay. And taking a patch, because I noticed that, some people are saying, okay, the hormone treatment didn't work for them. And then someone else says the patches did. So how are the treatments administered? There's a pill form, there's an injection. How is it administered exactly?
So there are pills available now. In pills, again, there are a lot of variations.
Mm-hmm.
One is called as a cyclical combined hormone replacement therapy, another is the continuous combined. So in somebody who still have their periods going on but
Mm-hmm.
have perimenopausal symptoms, we give something called a cyclical hormone replacement therapy, where the estrogen and progesterone both are given in particular doses. The progesterone is added so that the regular menstrual cycles what the patient is experiencing continues along with the hormonal support.
Mm-hmm.
And for somebody, suppose who has not had any menstrual cycles for an year or so, we can give something called as continuous combined hormone replacement therapy, where this variation, what we do to maintain the normal menstrual cycles, is not done, and you just have a combined pill which you take every day. It's
Mm-hmm.
not cyclical; it's just the same pill what you take every day continuously. Suppose
Mm-hmm.
somebody doesn't want to use in the form of pills and they have only particular concerns, like somebody has only vaginal dryness or discomfort during sex or recurrent urinary tract infections. For such people, we can offer vaginal creams, rings, and pessaries.
Mm-hmm.
These are mainly to cater for the symptoms. So you have only localized symptoms. So we can provide you therapy only for that. You need not take the pill.
Mm-hmm.
Again, some people do not tolerate these medications or pills very well. In
Mm-hmm.
them, you can try the estrogen patches. Now, again, with respect to patch, it is very important that you use it correctly. For
Mm-hmm.
some, it might not be working because it's not used properly. You have to always apply the patch in the clean, dry area over your lower abdomen. and you have to change the patches. Now it varies. Few patches you probably have to change once a week, few once in 3 to 4 days. It depends
Mm-hmm.
on the brand, the composition, and the dosage.
Mm-hmm.
So there might be several reasons why it's not working for some women. Probably
Yeah.
you have to go back to your doctor and focus on all these small issues. And I hope
Mm-hmm.
the other options work for you.
Mm-hmm. Okay. So, like most things in medicine, there might be a little bit of tweaking it for the individual patient.
Definitely, definitely.
Yes.
So
Okay.
some things work for few people, some doesn't. And
Mm-hmm.
it's always, try one thing, it's not helping you, please go back to your doctor. And some patients, like, again, another important thing is, it's not like you start treatment today and you're going to have relief tomorrow.
Mm-hmm.
Most of the treatment, especially the hormone replacement therapy, takes some time. The first 1 to 3 months you might not notice a lot of changes. You might still have some symptoms, and you might feel that the treatment is not working,
Mm-hmm.
because we start with the smaller doses,
Mm-hmm.
and it will take a little bit of time for your body to get adjusted to the medications. And usually within 1 to 2 months you will start seeing improvement in your symptoms. So that is another important consideration, that just because it's not working for initial few days or weeks, do not be disheartened. Go back, talk to your doctor, and I'm sure that you'll find a way.
Mm-hmm. Mm-hmm. Okay. All right. Well, Irvin says, maybe she's willing to give the patches a try. So that's good. She's hesitant about medication, but the patches are still giving you some dose of medication. Is that right?
Yes, yes. So
Yeah.
patches give release medications in a slower way. The dosage might be much lesser than the oral medications, but
Mm-hmm.
definitely something you can try. If the oral medications have not helped her, then she can try patches.
Mm-hmm. Mm-hmm. Okay. All right. So part of and let me ask you, Shamari, is the clinic, the menopause clinic, available at both locations, or is it just one of the Health City locations?
That is a good question, Sandy.
Mhm.
I'll have to, Dr. Aditi, do you, I think it's just at Kamana Bay
At
or,
Camana Bay,
yeah,
exclusively at Camana Bay. But if
Mhm.
some patient wants to go to the east end, I think we can work it out,
accommodate.
or make some arrangements. But currently at Camana Bay, we have the menopause clinic, which is going on. Uh, the plan is in place. We have all the medications. Like I said, the investigations required for every patient has been tailored. And again,
Mhm.
once we see the patient, it will be further, individualized. And at the Kamana Bay, it is all set. It's going on.
Mhm.
Yeah.
Okay. And then some of the core tests you do: targeted blood work, mammogram, pelvic ultrasound. We got to talk about what some of these things are. So when you say targeted blood work, what does that include?
So, like I said, not every patient will require all the blood work.
Mm-hmm.
So, for some, especially the hormonal blood work, for some it might not be required that you do everything.
Mm-hmm.
But for some, you might require, especially like all the FSH, LH, these are the hormones what we check, testosterone levels, estrogen levels, we check. And for somebody, suppose who's 60 years old or more than that, the hormones might not be very evidently, useful for us.
Mm-hmm.
So other than that, it's not only the hormonal blood work we are doing, we are looking it on a whole. So the lipid panel, blood sugars, cholesterol levels, mammograms. Again, mammogram will be individualized as per age criteria, family risk, similar with the bone density. If you have had history of recurrent fractures, or if you are somebody who's known to have weakened bones or osteopenia, then we definitely offer all these investigations to the patient.
Mm-hmm. Hmm. All right, very good. We have some comments coming in, and we want to ask you about some of this. Let's go ahead and take one from WhatsApp. One of our listeners is appreciative of the program, and they say, "Thank you for this show. For me, no symptoms I knew of until I hit 51. Anxiety and medical anxiety was crippling. My doctor was great and had monitored my levels from 48. I started the patch at 51, and it is a godsend. I would recommend, if you're not getting answers from your doctor, to see someone else." So again, to people who say, I went to the doctor, that didn't work for me, definitely don't stop there. Keep going until you get answers. Morning to Lavana. Miss Doreen says, "Good morning, doctor. Please tell the lady that they can change their diet. The more you eat processed foods, the more symptoms you will have. I have most of the symptoms, and I changed my diet, and it's worked for me." So I know that diet is an important part of all sorts of things in life. Everything from, obviously, even helping with some of the symptoms we talked about, insulin resistance and all these other things. Even depression now, they're saying that it's linked to diets, right? So of course, that is ultra important. Your comments there in terms of diet and exercise.
Very, very important, aspect is diet and exercise. So it's not like you start it only once you start developing your menopausal symptoms. The
Mhm.
earlier you start, the better, especially when you're having these hot flashes or like any other sleep issues. It is very important to avoid processed foods, especially the ones which have a lot of salt and sugar in them. Go more for plant based fruits rich in vitamin C. The citrus fruits, berries, they are rich in antioxidants. Again, keep a watch on the water content, the amount of water you're consuming every day. So, dehydration can always precipitate these symptoms. So, being very well hydrated is equally important.
Mhm.
Consuming a lot of fruits, the ones which are rich in vitamin C, antioxidants, and staying away from processed food. Also, because like we said, this is a transition where your blood sugar, your blood cholesterol, blood pressure, everything can go haywire. So keeping
Mhm.
everything in mind, which is why in the menopause clinic we also offer a nutritional advice where
Mhm.
every patient is advised the kind of nutrition which they are supposed to take based on their body weight, their medical issues, and the kind of amount of protein you're supposed to take every day. Everything will be uh, targeted and informed to patient in an individual manner. So on the whole, we all know this, that what are the kind of food we are supposed to have and what we are not supposed to. A
Mhm.
little more emphasis is required for the same when you are reaching menopause.
Mhm. Okay. Another comment says, "God help our female ancestors that went without help." So that's a very, very good point, because I suppose for a very long time they had no idea what was even happening to their bodies. So Strong Wilt says, "I take so many pills and it still does. It still. I'm assuming that means doesn't help." So again, continue to reach out to a different physician who might have a different treatment plan for you. Doreen says the hormone replacement has side effects, which can be cancer. So let's talk about what we know about hormone replacement therapy and any links to cancer.
So yes, see, every medication that way has some or the other risk, and we
Mhm.
always in medicine say that outweighing risk, benefit versus risk is the way to go. Now,
Mhm.
that is why we consider a lot of factors when we are starting somebody on hormone replacement therapy.
Mhm.
So, the common side effects, what everybody is aware of and worried about, one is the breast cancer.
Mm-hmm.
So there is a risk, but it is a low risk. So there
Mm-hmm.
are, you can say, around 5 extra cases of breast cancer in every 1,000 women who take combined hormone replacement therapy, say for 5 years. Now, which is why we, do a meticulous screening for the
Mm-hmm.
cancers, especially
Mm-hmm.
the breast cancer. If you are somebody who have had a breast cancer in the past, or somebody with a significant family history, then we do not, we individualize the treatment in that manner. Second, because you will be on regular follow-up once you are started on hormone replacement therapy,
Mm-hmm.
you will be on regular follow-up with your physician and gynecologist. So regular checks, regular breast examinations, mammographs will be done, which anyways is required once you cross 44, 45 years of age to do regular
Mm-hmm.
mammograms. So that will anyways be done, and a thorough follow-up will be done. Again, the risk is increases the longer you take the medication and the older you are, which is why we always recommend to start the medications early, take care
Mm-hmm.
of your symptoms, and try to taper and stop it as early as possible. So
Mm-hmm.
only when there is a need, we give the hormone replacement therapy. If not, we try
Mm-hmm.
to taper and stop it at the earliest.
Right.
And again, when suppose like I said, there are estrogen only therapies, progesterone only therapies. There are non hormonal based medications like
Mm-hmm.
available as well. Like, if you are somebody who has only sleep issues, then we can do it without the estrogen progesterone hormone. We can give you medications particularly to cater those things. The
Mm-hmm.
second side effect, what again everybody is worried about, is blood clots. Again, which is why a thorough history of blood clots, family history is taken, and only then we provide the hormone replacement therapy for the patient.
Mm-hmm. All right, we have a question or comment here from Sherry K, who says that she's joining us from Rotan Island. And I had a hysterectomy, and the doctor did not advise me that all of these symptoms were coming behind. And I suffered for years with all the problems. But after 10 years, I started doing my own research, and boy, I'm happy with the hormone treatment after visiting a doctor in Florida. Ladies, try them if you can. You won't regret it. So, someone who has used the hormone treatment after suffering, she says, for some 10 years and has gotten significant relief from that. So it's amazing that you can go to a physician in this day and age, and they, will recommend a hysterectomy for whatever reason, and then not tell you that the very surgery that they're recommending can have these life altering side effects. That is so unbelievable, but there you go. We have another listener to the program. Says, I just tuned in. Thank you for today's topic. I've been postmenopausal for over 22 years. I went into early menopause naturally, not surgically. And I still have many of the associated issues, for example, brain fog, anxiety, itchy skin, crawling skin sensations. Ooh, wow. Itchy and tingling ears, hot flashes, mood swings, memory issues, weight gain, muscle loss, bone density loss, heart palpitations, and GSM. What is GSM? I don't know what GSM is. I don't know. Okay. It is great that this subject is becoming a more common topic of conversation. However, more support from the medical establishments and more education in relation to this topic needs to be implemented ASAP. On a side note, in my honest opinion, the visuals that Health City used to highlight menopause should not show photo of a mammogram machine, as breath health is what scared so many women off of taking HRT back 20 plus years ago. Okay. So again, I think you have it in the slide because it is part of the comprehensive
Exactly.
checks that are done. So it says the core tests are targeted blood work, mammogram, pelvic ultrasound. What is DEXA scan to
That
assess?
is the bone density scan, what we
Oh,
do to look for osteoporosis or osteopenia.
Right. So yes, I mean, the whole idea here is to ensure that you're not afraid of these things, because these diagnostic tests are designed to help you catch, if you do have any issues, to catch them as early as possible. And whether or not you're doing hormone replacement therapy or not, your breast health as you age is one of the risk factors for breast cancer. So you want to be getting these mammograms as suggested by your physicians. I do mine every single year. So, yeah, nothing to be afraid of. Don't let a slide scare you, folks. Um,
That can be a topic of discussion, right? When you're doing
yes.
something like that, the more we discuss, the more people come out, give their, it's amazing how all these people are sharing their experiences,
Mhm.
so that so that you know that you're not alone, and a lot of them are going through the similar symptoms, just that there is not much of a open discussion happening, which is why people think that it is probably something that it's only them going through. So
Mhm. Mhm. All right, just a few more coming in here in WhatsApp. So let's go ahead and grab those. And thank you, ladies, for your comments. Very, very good questions and commentary. So this next listener to the program says, if the HRT is processed by the liver, e.g., tablet form um, of estrogen and or progesterone, then there's a higher probability of blood clots. However, the patch and Marina coil takes that risk down to near zero. Is that right?
uh, it is partly correct. So of course, when you take oral forms, the side
Mhm.
effects are a little higher, which
Okay.
is why we do the risk assessment for every patient. And if somebody has risk of forming blood clots or malignancies, stronger family history or past history of, suppose somebody is known to have a DVT or a blood clot in the leg long back, or somebody had a history of stroke, then for them we definitely advise to go for patch and the coil. But again, patch and coil might not work for few of them, so it is not one size fits all. We have to individualize, and if the patch is working well for you, great. That is one of a very good mode of providing estrogen. It is a slow release estrogen patch, which definitely helps with symptomatic management.
Mhm. Okay, wonderful. Another comment has come in, says, with regards to risk, I was concerned also, but for me, as my doctor explained in my case, the benefit outweighed the risk. I now have a yearly mammogram rather than every 2 years, and risk have also been removed from literatures accompanying certain medications recently. So again, coming back to this, I guess we all have choices to make when it comes to our health and wellness. And one of the choices is that you silently suffer for years with all of these symptoms, or you look at your options in terms of what can be beneficial and helpful to, help you manage your life, because I can't imagine that it is comfortable to have hot flashes and all of these other symptoms constantly plaguing you, right? Your day-to-day life must actually be very, very challenging and very difficult. So as this person said, for her, she really just thought about, right, what
Yeah,
what
this
are
is
what are
right
my
way
risks?
to go.
Yeah.
She's doing regular follow-ups. The benefit was outweighed, and she's having symptomatic relief. And
Mhm.
the important thing here is regular follow-ups. If you're
Yes.
on medications, it is very important that you go for regular follow-ups, so that if there are any side effects, it can be caught on early, and the medication can
Mhm.
be tapered or stopped accordingly.
Right. Okay. Another question has come in. Blessed morning. Does the doctor have any suggestions when HRT causes endometrial thickening? Mm.
Again, not every HRT will cause that. It so which is why we give combined hormone replacement therapy in individuals who have thicker endometrium, risk of endometrial cancer. Uh, so when we always have to consider all these things, we do a thorough investigation before starting, doing pelvic ultrasounds, hormonal panel. It is all for the same reason. Uh, and again, if somebody has such risk, then the hormone replacement therapy will be tailored accordingly.
Mm-hmm. All right. So speak to the physicians, folks at the clinic here. They seem to obviously know, a lot of what they're doing. And so that's important. And that's why you want to speak to educated, well-informed individuals. And has there been anything in recent, say in the past 5 years, Doc, that has significantly changed, that gives women, even additional hope?
So a lot of women are coming forward and getting, all these preventive health checks done. So
Mm-hmm.
they are aware what they are going to face. So it's not like you're caught by a shock that all of a sudden you start developing all these symptoms and you're not aware of what is happening, and you go into a panic mode. So, with all the awareness and education going on, we can see that now people are aware what is menopause, what is perimenopause, what are the symptoms you can expect, and they're coming to us way early for the scans, mammograms. They're aware of the hormone replacement therapy, and it is also available in a lot of forms now, patches, gels, and all these things. So we can see a lot of them coming forward, which is a good thing, but many of them are still not aware that there are options and they need not suffer for years together.
Mm-hmm. Okay.
Also, I think in the past there was a lot of talk about the side effects, more about the side effects than the effects, probably 15, 20 years ago. But now with the studies, we know the percentages, we know the risk factors, we know what kind of patient might develop a side effect and where we have to avoid these treatments. So keeping all this in mind, it you have to always, like the other reader said, you have to always outweigh the benefit, and according to your symptoms, according to your uh, history, we have to cater a plan for you.
Mm-hmm. All right, wonderful. So, how can they contact the clinic? Folks, as usual, you can email Health City, you can call them, so that they can sit down with you, do a full review, do all of their intake process. You get input from the specialist team, including a gynecologist, physician, nutritionist. So, it's not just that you're going to go see just one physician and they're going to tell you, the things that you need to know. In fact, it is a very comprehensive team that is going to be reviewing your file, reviewing your results, and giving you feedback so that you can have this personalized plan that includes lifestyle support, HRT if appropriate, non-hormonal options. So that's why you're seeing people like the nutritionists, right? They're going to look at your diet, see how you can make improvements there, supplements, and any scheduled follow-ups as well. So yes, what else? So there's we've talked about this in relation to the hormone replacement therapy, and it's very, very important that if you're going to do HRT, that you're definitely being monitored by a competent physician.
Yes.
Doc?
So yes, so it is very important. So first, you can, whoever want is suffering from these symptoms, or if you're not even aware that what's happening to you is menopause, if you're confused, please come ask for menopause clinic, where you will be examined in detail, taken all the history, relevant investigations done, which will be discussed with you by a physician, a gynecologist is required, nutritional support will be provided, and follow up thereafter on the whole, not only for menopause but also for your general health. So you can ask for menopause clinic, book your appointments, and we'll take care of you after that.
Mm-hmm. All right, beautiful folks. Health City Cayman Islands, again, offering another amazing service. The clinic for menopause is open and ready to service the community. And another person says that you must consider the person's quality of life as it relates to the impact of the symptoms, especially for those that suffer long term. Like I said, some of the stories that I've heard is downright uncomfortable. And there is a question here, which I don't know if we're prepared for this, but someone is asking if you can ask about the male menopause. So we do know. That as Shamari mentioned from the onset, that men actually do go through their own form of menopause as well. Are we looking at potentially having a male menopause clinic? I don't know.
So, especially the month of November, was concentrated a lot on men's health. We've been talking about andropause, which is nothing but, the male counterpart of menopause. Again, it's not very much spoken about, especially men's health and andropause, which is why in the month of November, we've done a lot of talks and campaigns to create awareness. Yes, of course, men also have these symptoms. Even they go through similar symptoms. A lot of men come with mood swings, sleep disturbance, hot flashes. It might not be as pronounced as it is in women, but a lot of them go through similar issues. And there is option of hormone replacement therapy even for men.
Hmm.
So, of course, even at Health City, we are addressing to it as andropause, and anybody who has symptoms can definitely reach out, and we'll help you with that.
Hmm. Hmm.
And
Uh,
Sandy, what we're
yes.
looking at is obviously um, in the future reaching out to the ladies, whether
Hmm.
wives or girlfriends or sisters or mothers, to
Hmm.
identify the symptoms in men as well, so that we can
Hmm.
get the women to encourage the men to come see us if they
Yes.
are seeing those symptoms, so that we can potentially be able to help them as well. Knowing that
Okay.
if we leave it up to men for the most part, we probably wouldn't come to seek help. So we're figuring out ways to make sure that we can get the
Yes.
partners of the females to definitely come and see us as well.
Yeah. And to this person's point, she says, I thought my partner was trying to steal my thunder. Trying to steal your menopause thunder. Oh my goodness, the sympathy that you can get with it. But no, apparently they're going through their own changes as well. So it's good to know. That's why education is so important. That made me chuckle. I was like, oh my gosh. But it's important to know these things because without knowing these things, then yeah, this is what we think. Why is he complaining? I'm the one who's having the hot flashes here. And meanwhile, he's sitting there going, yeah, I'm having some as well. Well, thank you so much, Doctor. Let me see if I can pronounce it
Aditi.
right. Aditi.
Aditi.
Yes.
Yes. Really appreciate you coming on the program. And if you have no symptoms and you're still doing, I guess, your annual checkups and everything else, is that good enough?
Yes. So when
Yeah.
you're doing your annual checkups, we definitely talk about menstrual cycles,
Hmm.
regularity, symptoms, irrespective of the patient complains about it or not. In our regular annual health checkups, this
Hmm.
is included. So if you are
Hmm.
visiting your doctor regularly, once a year annual health checks, which will also definitely include mammogram and all the other investigations, which is necessary even for menopause.
Hmm.
So if you do not have symptoms, annual health checks are good enough, and please continue with that.
Okay. Wonderful. Sounds fantastic. Well, thank you so much. Really appreciate it.
And
Thank you. Thank you for
perfect,
having
Sandy.
me. It was great, talking to all of you, and amazing questions from the listeners. Really, really appreciate them coming forward and, sharing their experiences and talking about menopause.
Yeah, absolutely. Shamari?
And sadly, no, that's what I was going to say. That as you can see, this topic discussion was needed. Seeing the amount of
Hmm.
engagement we have had, obviously people like to WhatsApp you, which is great because you put it up,
Hmm.
and more people can hear the questions and be able to hear the answers from the good doctor as well.
Exactly.
And this is why we specifically went about creating the menopause clinic, just knowing that there needs to be more conversation as well
Hmm.
as there needs to be a holistic approach. So Health City, as we build out our women's health, are looking to do more and more things like this so that we can
Hmm.
get into obviously the preventative care, but obviously through the different stages of women's lives. We want to make sure that we're there at every stage to be able to help
Mhm.
them as best as possible. And soon come, we'll be able to, we'll label it separately, but we'll be able to put out the symptoms out there so that men can also get help as well with our men's clinic that will
Mhm.
be coming forth in the new year as well.
Yeah. No, I
So
mean, it really is good to know that people are asking good questions from their experience, and they are seeking to be better educated on these topics, because that's where it starts. Understanding that none of this has to be taboo. We're all going through something in one way, shape, or another. Our bodies change as we go through life from the earliest stages straight through, and knowing what's happening to you, I feel like that is oftentimes 50 to 60% of the battle, of the confusion. And so, yeah, I mean, it's good to know that there are professionals there who are specializing in these areas, who are putting an entire clinic together. This makes like so much sense for me, to kind of have everything centralized in one location, where you can go and you can have all the testing, the range of testing done, and then you can have a team review the results, and then you can sit down and have a cohesive conversation with a physician based on all the findings. So I think that this is fantastic. Thank you so much.
definitely. And just a reminder, info@healthcity.ky. If you want to send an email to book an appointment, or
Mhm.
you can call us at 640-4040, and we'll be able to definitely get you to the menopause clinic or any other appointment that you may need.
Yep. Thank
And
you very
Sandy,
much. Yes.
next week is our last week before Christmas, so we're gonna have some goodies and giveaways, and
Oh,
so people
good.
better make sure to tune in next Tuesday. Hopefully, I'll have another great
Awesome.
Dolphins update, and also we're gonna get some giveaways next Tuesday
Mhm.
as well.
I love it. Thank you so much to both of you. Have a
Thank
wonderful,
you.
wonderful week.
Thank you.
All right. Thanks. Bye bye. So, yeah, Shamari is reminding us, folks, that Christmas is right around the corner. OMG, it's coming. Ready or not. Oh, this year, I think I'm going to be totally low key. In fact, I'm looking for someone's house who I can just come to and have Christmas dinner. I'm like, you do all the cooking. I'm just going to show up and eat. But I must warn you, I require a hybrid Christmas, which means, yes, I want the traditional Caymanian things, but I also got to have my turkey. I got to have my ham. I got to have my candied yams. So I got to have certain things from the American Christmas menu as well. So, if you can help me out, message me. We'll talk. Every year I feel this way, and then I end up getting in the kitchen anyway. So I don't know. I don't know what this year is going to bring. We've got a lot of people who normally are in our group of invitees. They're traveling. They're going off island. They're not going to be here. They've got other plans already. So I'm like low key feeling like, maybe I won't really do a whole lot in terms of cooking anyway. So I don't know yet. We'll see. Although somebody messaged me yesterday and said, Sandy, I'm working on getting you your Cayman beef. And I was like, oh man, who can say no to putting some of that nice beef in the oven? All right. Well, we'll work it out. We'll work it out. So listen, big shout out to Digicel. They have some specials going on. Today's the last day, though. It is December the 2nd, right? So you guys need to get on this, because you're going to miss out a really amazing opportunity to capture some sales on devices. You got to pre-plan for Christmas these days, because we're on a budget. So that means that you shop around, the last Thursday events. Then we had Friday sales going on. So we had the big, what was Friday called again? Oh Lord, what's this? Whatever. Yes, it was Cyber Monday. Friday was Thursday. No, Thursday was what do we call it again? You guys know the big sale names. Anyway, shop around the Thursday, and then the Friday, and then Cyber Monday to compete, just in case you missed anything. So lots and lots of sales going on. Of course, did you sell Black Friday? Thank you. I was like, what's it called again? All right, Black Friday sale, yes. And not to be outdone, Digicel has ensured that there are these amazing Black Friday deals that they have on offer. So they've got a couple things. Prepaid customers, you can get a Samsung A26 for as low as $115. They have the A36, which is $215. Or you can do the iPhone 14 for $395. That's up to 60% off. And then you also get it bundled with a prepaid plan included, which is a pretty decent deal. So for the A26, which is only $115, you get a 5-day plan. For the A36, which is $215, you get a 10-day plan with that. And then for the iPhone 14 for $395, you also get a 30-day, that's an entire month plan included. Now, not to be outdone, postpaid customers who always feel sometimes a little bit left out, we're like, yeah, we're postpaid. What are we getting? Digicel has thought of you. Don't worry. You can get the new brand spanking fancy new iPhone 17, which is really an amazing phone, right? I can tell you. So they'll give you the 256 gig version for only $999.99. $999, honey chill. That's over 60% off the original price of $1,500. And they sweeten the deal for you by giving you the option of actually financing it. So, you can get a couple months to pay that off, put it on the bill, then why not? This is a fantastic deal. So make sure that you don't miss out on this opportunity. This is great. So thank you so much to Digicel for putting these specials on offer. But today is the last day, so you better get in to any of the locations today. Do not miss this sale, folks.
Christmas, the season of love, laughter, and just a little bit of chaos. Sometimes the ham has other plans, and sometimes the road to Christmas cheer feels longer than the 12 days themselves. Was it 3 eggs or 4? Better call Granny. She always knows. And of course, what's Christmas without a little potluck drama? But in the rush and the mix-ups, it's easy to forget what matters most. That's when the magic of connection happens. Because after all, Christmas isn't about perfection. It's about real connection. This Christmas runs on Real Connection. Only with Digicel.
Oh, I love that commercial. I love what happened to the poor ham. I'm like, oh my gosh. Who hasn't burnt up a little dish here and there? Trust me, it happens. It happens to the best of us. Oh my goodness. What's your favorite part about Christmas? We're going to be talking about all these things as we move into the holiday. It is December the 2nd, folks. I love the month of December. From Thanksgiving, I am all in terms of the holidays. So I cannot wait for Christmas to arrive. Good morning. Oh, somebody was calling. Oh, not sure if they meant to call, but okay. So yes, lots of, amazing things happening in the month of December. It's a time for family and friends and good food and just getting together and having, so much of an amazing time. So yeah, why not? You can visit, there are 3 available locations. We've got Kimata Bay, the waterfront Georgetown location, and Countryside as well. So this is while supplies last, and they've had it on since last week, Thursday, just in time for the Black Friday deals. So I don't know what's left in inventory, but honey child, only one way to find out. Just pop into the store. Good morning to Jasara. Irvlyn says you're having brain fog. That's a sign of menopause. Maybe that could be, because I'm telling you, I haven't really noticed any other signs. Not much has changed, but I'm staying in a very positive mindset, and I am hopeful that I'm going to be one of the lucky ones that really doesn't have a whole lot of signs at all. I'm here for it. Don't give me any hot flashes, universe. I don't need that in my life. Don't complicate my life. Yeah. So good morning to Miss Sue. says, what I love about Christmas is the togetherness. Miss Speak Your Mind. Me too. It does change, everybody gets in a particular mood. Gigi has been harassing me. She says, Mom, have you ordered her Christmas tree yet? And I was like, oh man, no, I meant to do that because we like a live Christmas tree. But one of these days, one of these years, I should say, I am going to take the time to spend Christmas. Actually, I'm going to make sure I go to the Christmas tree website. I'm going to spend Christmas in a completely cold environment. Like I want to do Christmas in New York. Yeah. So I'm going to do like freezing temperatures, snow. Like you got to do Christmas in snow. The complication in our lives is Marlon can't do because of work. He's got certain blockout periods and Christmas is one of them. So we might have to leave Marlon behind, honey child, and go out on our own. I'm just saying. Sorry, Marlon. See you after Christmas. It's hard at this age though, because of course, Gigi wants to spend Christmas with Dad. I want to spend Christmas with Dad. It's challenging. But listen, speaking of Christmas trees, I shouldn't even tell you guys this. I should go order my Christmas tree first. But if you don't have your Christmas tree yet, make sure you check out our favorite deliverers of Christmas trees. And this is the Wonderland Christmas trees. So they're going to be out there with their lot starting from Friday. They were there. And so you can go and pay for your tree, collect your tree. And they also offer delivery options as well. So I am going to be definitely signing up for the delivery option. And there's nothing really and truly like a nice, wonderful, fresh Christmas tree in your house. There is something to be said for that. So I'm definitely needing to pay for a little Christmas tree and make sure that I get that ordered in due time. So yeah, check them out. They're right across from, let me make sure they haven't changed locations this year, but in the past, they were right across there from, they're at the Regatta Business Park, which is across the street from Cost You Less. Lots of space, lots of trees. And so the trees have arrived. Mm-hmm. And they have really nice, convenient evening hours up until 7 p.m. So beautiful. Love it. Honey child. So I'm going to have to make sure I get my Christmas tree ordered. And the great part about this too is they give they pick every year. They actually pick the like a charity to support as well. And so yeah, they support a charity. I can't remember what size I normally get. I have to ask. Okay, so I will inquire about the size. I can't remember, but yeah, I'm gonna get on that. All right, Strong Wilt says the best thing I like about Christmas is collecting gifts. Wait a minute, collecting gifts to give to other people or receiving gifts for yourself? That's the better question. Good morning, Dalcy. How are you? Plain and straight. Good morning to you. The food and the memories I create with my family, says Miss Speak Your Mind. I know what you mean, honey child, because I be having me some serious food memories now. That Cayman style beef. And listen, nobody does like a family potluck or Christmas dinner better than a Caymanian family. Can I just tell you, oh my gosh, we're all in. We are all in between the meats alone. Like I have been to these Christmas, family events, especially when you got East End adjacent family, right? No less than 10 meats. You're going to have your beef, your conch, your turkey, your ham. What else was on the menu? Oh my God. Oh Lord. They throw in a little Wilkes occasion. I mean, it's like sometimes I've sat there and I've counted like 10 meats and I'm just like, how do I pick and choose? It's all so good. And then all of the sides are just like mouth watering. Oh my God. Have you ever ate so much food? Let me ask you a serious question now. Have you ever ate so much food that your stomach literally at that moment expanded, like you felt like you were pregnant? You're like, oh my God, I can't even move. Yeah, been there, done that. I'm pleading guilty. 1 year that happened to me, like I legit, oh yeah, of course the turtle wouldn't be Christmas without some turtle. Yeah, I ate too much. And it was just like, oh my God, I couldn't even move. The Wilkes, the lobster, yes, Paul the man. And then what do? That's right, Yoni. You sit down and you go into food coma. Now, this year, I'm making some changes to my diet. It's not a diet, Miss Stacy. It is lifestyle changes. So some of you have seen me in person. You're like, wow, Sandy, you're looking slimmer. And I'm like, thank you very much. The first thing I'm doing is I'm cutting down how much I eat, the frequency of eating. So no snacks, really. We grew up with 3 square meals a day plus snacks in between. Apparently, somebody was telling us misinformation. Every time you eat, you're spiking your sugar. So if you're particularly concerned about that, you need to cut out all the snacks. And it doesn't matter what you eat. Because I'm sitting there going, well, what if I'm snacking on nuts? Those are healthy. Anytime you eat, you spike your sugar. So if you're really, really, really concerned about maintaining, those glucose levels, stop snacking. Stop eating so much because your body is in constant spike mode. So most days, not every day, but most days I'm actually doing 1 meal per day. Okay. And so what that means is that I eat 1 meal a day. So I'm basically going 24 hours. It's called OMAD, 1 meal a day, literally. And so I go 24-hour periods or a little bit longer without any food. On weekends, I tend to go back to like twice a day. So because, with Gigi around, we tend to eat breakfast and then, something a little bit later on that will count as dinner. But yeah, I'm trying to cut out all the snacking and stuff in between. And the other thing now is when you eat, especially when you're going to have a big meal like this, because listen, Thanksgiving, when I lived in the States and we did Thanksgiving, because that is like the bomb, right? All you did was watch American football. You overate and you only ate once for the day because you couldn't hold any more food. My aunt would get up the day before and start prepping and making everything. She made everything from scratch. Like I honestly, when I reflect on it now, knowing how much is involved in even just doing certain dishes, I don't even know how she did it. She would go all night long, well into her senior years, cooking like that. And I'm just like, wow. Her sweet potato pies, oh my God, to die for, from scratch. So what we now want to do, instead of sitting down and getting ethnic fatigue, y'all know what I'm talking about, those food comas. What you want to do instead is go walking. Yes, move after eating that big hefty meal. Go for a nice little walk around the neighborhood. Say hi to your neighbors. Put on that Santa outfit, or at least your Santa hat, and wish everybody a nice Christmas. Go outside and play some pickleball. I'd be challenging people to pickleball when they come over for Christmas, right? You got to get on the court. Now, this year with my knee, I don't know how it's going to go because I haven't played in quite a number of months, but I'm going to get back out there soon. But yes, get moving. And, you're absolutely right. Who said about not eating after sundown? Yes, Uni. Cutting out how close to bedtime you eat is also really, really important. But let me tell you, this time of year, I'm not stressing y'all about no diets or no special considerations. Moderation is the key because you can't overdo it all December. And so you got to do it with moderation. But one of my favorite things is back. Hold on a second here. This is, oh Lord, with Waffle Monkey has a dish. Every single, oh Lord, hold on, let me find it. They have a dish every single Christmas that I'm so excited about. And I'm going to show you guys a picture. Hold on. I think Scott sent this to me last week. And so I messaged him and I said, hey, Scott, what's going on? And he's like, are you messaging me about the special? And I was like, well, sort of. Do you have it again this year? So this is what they do. They combine. Look at this. It's like the most, certain foods just go together, right? Like certain foods just belong together. Like turkey and gravy and stuffing and what do you call it? The oh Lord. Here's my memory loss again. What's that little side thing right there? Oh, cranberries go together. But I don't like the cranberries like this. I like the smooth one because I don't like the texture of those little things in my mouth. So I like it nice and smooth. But look at what they have brought back. So can I tell you what this is? Because I'm going to have this at least once this month, if not twice. I'm going to be treating myself. This is lunch. This is Thanksgiving on a waffle. So think about it. The waffle is made of stuffing. Amazing idea. And then you've got turkey on top. You have between the waffle and the turkey a layer of mashed potatoes. My God, who thought of this? Then they put this nice succulent gravy on top. Yeah. And then you've got your side dish of cranberry sauce. Oh my gosh. All nice and warm. It's like Thanksgiving stacked on top of each other. Can I tell you, if you've not tried this at Waffle Monkey, go and tell them that Sandy sent you and you need to try it because it is amazing. Oh. So good. So good. Yeah. Let me see. Okay, so looks good. Okay, love it. Go by and check it out. That's all I can tell you because it is woo-wee, well worth it. Sandy, are you going to lose weight? How are you going to lose weight and you love food so much? I know. I do love food. And it's all about moderation. Listen, I'm not here telling y'all to be on this super strict diet and all this kind of madness. Those things aren't going to last. That's I'm like, change. If you tweak certain things about your lifestyle, you'd be surprised what you can do. Eat less in terms of volume, quantity. Eat better in terms of quality and move more. That's the basics of it. At some level, we don't need to overcomplicate it. Some people get into, macros and this, not. I'm like, whoa, back it up, honey child. You're complicating my life. I get it. And I understand a lot of those things, but there are little changes that you can make that go a long ways. Delsey says, I'm really going to miss all that nice food at Christmas time back home. You better try and make a little trip. I'm just saying. Miss Ethel says, sorry to put a damper on the Christmas spirit, but not everyone enjoys Christmas. Speaking for myself, especially because of my traditional strong link, big sister / mom, Liasa Morrison. Explain that one to me. I'm missing that a little bit. My traditional strong link. Miss Ann said, my mom did too, Sandy. Thanksgiving was the best. Morning, Sophia. Morning, wee wee. How y'all doing, honey child? All right, so get your Christmas stuff on fleek. I don't even know what's on the Christmas shopping list this year. I don't even know. Like, I'm in the middle of a project. Low key, my budget is tight. I ain't got no money to be spending on Christmas. So I'm thinking, one little present per person. My present to myself is going to be kicking out my feet on Christmas Day and relaxing, sleeping in maybe, I saw Gigi put a Christmas outfit on Zeus the other day, and he was not happy. He's like, what is wrong with you people? Oh God, he started to remind me of Coco. Like anytime you'd put a Christmas outfit on her, she'd stiffen up. Like all of a sudden she walked like really stiff. And so he started to do that. And I was like, oh, poor Zeus. He's like, why? Why are you guys dressing me up? But you know, he's got a Christmas outfit. I'm gonna try and get him one other one. Because yes, it's this time of year now where it's just so cute to put them in a little something special for Christmas. Ooh, they've got the Christmas doggy tuxedo. That looks cute. And it's just like in the front, so it's not too bothersome. He probably like that. Oh, look at this little cute shirt that says, I still live with my parents. That's okay for doggies. You have to be careful though, because it's still warm in the tropics. I try not to get him anything that is too warm. But yeah, I'm thinking a little Christmas outfit for him would be super cute. Another one. Ooh, they got little overalls. They got the cutest little, they have the cutest things for dogs, the cutest outfits. Oh my gosh. Look at the Christmas doggy pajamas. No, that is so adorable. Aw. Zeus is going to be like, really? If you put me one of those girly outfits, I'm going to slap you. Look at, I got to show you guys this one, right? This is when you know you need to have a child. When you have a dog, but you probably should have a child because you got way too much time on your hands and you're spending money. Look at this dog. Is this not the cutest thing? This is definitely a female dog, has hair braided. They actually grew out the hair long. This is the Shih Tzu. This is why people love them, because you can do so much with their little hair, right? So it's braided on the top. Look at that little ponytail. The ears are nicely groomed. Oh, so adorable. And then look at the little sweater with the bow. Is that not just the cutest thing you've ever seen? Oh my God. So adorable. Ugh, I remember those days. No real responsibility, no child. And so the dog got all my love and all my money, child. I'd be dressing poor Coco up, and before her, my other dogs. What a free life. Then you get real responsibilities. You grow up and you have kids and you're like, what a mess. All right. So I love the Christmas sweaters and stuff for the little pooch. You got to make them feel, oh, there's a Grinch one here. You got to make them feel like they're part of the family. You know what I'm saying? Yeah. Christmas pajamas is a thing. All right. So listen, we got a bit of good news on Friday, I think it was, that finally we have had some degree of accountability as it relates to the CIN, Cayman Islands National Attraction Authority. So remember this guy? Y'all remember him? Yeah. Well, he's back in the news for finally being put on administrative leave. Now, I know a lot of you, I saw your comments and you guys are like, Sandy, please, how long does this process take? Well, it takes a hot minute. It really does. It's government and it's government adjacent. So the people who they should be putting on immediate leave and suspension, they really take their times with. And, you know, I get it because on the one hand, they know that, you know, someone like him, although he knows how wrong he is and all the stuff that he's been doing, he would be the first one to try to lawyer up and sue somebody. So that being the case, the government and the board has to really make very, very cautious and meticulous steps when it comes to dealing with him. So I don't mind it. This is the process, right? This is due process. You guys remember me talking about it yesterday. It comes all the way from the top leaders and countries down to boards. There is due process that you have to go through. And I don't mind the due process. My only thing is, can you speed it up just a little bit? I mean, due process doesn't need to take 5 years. You know, that's what I'm saying. So yes. Oh my gosh, somebody just sent me their little cutie patootie in her Christmas outfit. I love it. Let me show you guys this one. This is so cute. Oh my gosh, I love it. Thank you so much for sharing the picture of your little one. This is just hilarious. I love it. Look at this. Is that not the cutest thing you've seen? Oh my gosh. So pretty. Aw. All right, back to Patrick. Not cute, not pretty situation at all. So yes, he was getting away with the most, but you know what Caribbeans say, right? Caribbean people say, Sandy, one day the pot can drop out. And I understand the concept all too well. And quite frankly, the bottom can drop out of your pot, right? You take the what's the saying? You take your bucket to the well every single day, and you think that's the way that it's always going to be. But one day, the bottom can drop out. So you can do as much as you want, all this bad behavior, but it does not last forever. That's the thing that's important to realize. It's not going to last forever. And so there is a day of reckoning. And finally, after a 3-day expose on the hot mess that is known as the Cayman Islands National Attraction Authority, we are getting close to the day of reckoning. So the board, as well as the ministry, issued a joint statement to say that Patrick Thompson has been placed on administrative leave. And like I said, there were some people commenting like, administrative leave, what on earth is that? Yes, he's still going to be getting paid, but it is the first step to a proper and thorough investigation into the allegations. And obviously, it means that they found something of concern. That now they are saying, whoa, buddy, we got to put you on leave. They say in their statement, the board has confirmed that the director has been placed on administrative leave effective immediately and until further notice, citing an investigation and audit by the Cayman Islands Government Internal Audit Service into a number of serious allegations concerning the director and other senior staff. Let me give them a kaboom. Praise the Lord and hallelujah. It's about time. Somebody was listening. Okay. Thank you, Minister, because we know he had to go in there and replace the board in order to get this far. I dare say that under the leadership of the previous board director, unfortunately, I have my doubts that anything would have ever gotten done. Ironically, after this story dropped on Friday, I had someone reach out to me, and I'm going to read you some of the comments that they shared. And they had the following to say. Let me see here now. Hold on a second. They said, had Carla listened to us from long ago, this could have been avoided. So people were trying to tell her, why are you trusting this man, girl? What is wrong with you? And she just wouldn't listen. She would not listen. And Carla Reed was the board director. This other person said she was disgusting and removed persons who questioned her. She had several run-ins with other board members because they were like, something's not right here. And then, she added Lorna Bush, they say, to the board because she was a yes person who was overly confident and just clueless. Good morning, caller. Hello? Hello, I can't hear you. Hi, caller. Nope, didn't work. They go on to say that she knew that she allowed things to occur under her watch and questions were raised at the board level. What I don't understand is if government persons are placed on a board to ensure good governance, why is it that when we raise the alarm, no one takes heed? Questions have been raised for years over the youth garden, for example, and all of the items were discussed. even human resources, hiring, etc. So they say that a lot of the issues that we eventually put together as a full and comprehensive multiple day expose were things that, over the years they were questioning, and it was just completely being ignored. So there is a bigger question here about board accountability. And I have said this before, you should not be taking on a board appointment, whether you're the director of the board, or the chairman of the board, the deputy chair, or even just a board member. You don't take on that role without understanding that comes with a degree of accountability. Good governance requires you to go in there and to do an effective job. You're not there for just a free meal. No. So we listen. Accountability is the order of the day, as far as I'm concerned. Thank you for this other I'm so cute pooch photo. Look at this one by the Christmas tree. He's an elf. Isn't that adorable? I think that this is she. Is this a she or he? I'm trying to remember. But anyway, cutest little dog ever. Well, this one's competing. They're competing with the cutest dog ever. Pageant. But I love the outfits. Look at this one. OMG. So cute. So adorable. Thank you for sharing. Absolutely love them. So yes, honey child. It's unfortunate that, it had to come to this, but nobody was stopping this man. He was just on a mission of his own to do whatever he wanted, whenever he wanted. And it was just like, okay, nobody's going to stop me. I'm going to do it. And who cares? What are you guys going to do kind of vibe? It's unfortunate. It really, really, really is unfortunate. Ay. What a hot mess. Anyway, what I can tell you is, like I said, there always is a time of reckoning. I reckon there's a time of reckoning for everyone who is into wrongdoing. And so his time is up now. They're carrying out an internal audit. And oh my gosh, I cannot wait to see what that report says. We already know that the garden. Now, the one question that somebody had, and this is actually quite a valid question, I must say, is they're like, hold on a second. So they get rid of Patrick and put him in administrative leaves. Kudos, right thing to do. However, the acting director is now John Loris, who's the general manager of the Queen Elizabeth II Botanic Park. And there was a lot of questions around his behavior as well, including the garden and the financing and funding for that, as well as how orchids and plants and all sorts of stuff are disappearing. There are questions, more questions than answers, obviously. So funny enough, just as I'm asking that question, somebody sends in the question. Let's see what they had to say. So I think the board, again, is perhaps being a little hoodwinked into not understanding the full scope of what is going on here. And so that in and of itself is alarming and concerning because the allegations go far beyond just Patrick Thompson. So this person says the following. People are asking the right questions. Yes. But why is the right hand of Patrick, the man for the Botanic Park, John Loris, given a pass and allowed to stay in charge? He's a major part of the problem. Well, I don't know how major he is, but he's definitely part of the problem. Yeah. They did everything as a duo, uncovered for each other. The Auditor General's report and findings confirmed these facts. And they go back to the Auditor General's report in relation to, that in relation to that garden, the children's garden. So we will ask questions of the board. I mean, obviously, the board has the discretion here. And all I can do is pass along. And we did cover John in the situation as well. I think what it is that John wasn't anywhere as bad as Patrick. So maybe that is why he is getting a little bit of a pass. But nobody should be getting a pass. Come on. Right? Hi. Good morning, Miss Della. Marshall, how are you? Marshall says he shouldn't be getting any pay while on leave. Well, they do this consistently for everyone. So it is the process, because he's not yet been found guilty of any wrongdoing. So this is just the investigative stage. All I can say is they need to make sure the investigative stage is done as thorough as possible and as quickly as possible. Right? Don't leave anything unturned, but also don't make this take 6 months, a year, while he's sitting at home getting paid on administrative leave for no reason. So once you place someone on administrative leave, those types of investigations, in my humble opinion, should be expedited as quickly as possible. Because yes, they are getting paid to do nothing now, to stay home, and they're getting full benefits. Okay. Ms. Dallas says we need to stop all the enrichment off of the public purse. Why can't Caymanians hold these positions? Sorry, my apologies. We got to get back to doing our squats, by the way. Why can't Caymanians hold these positions? In fact, a born Caymanian should hold this position. And the irony of you saying that, Ms. Della, is that a born Caymanian held the position before. Here, they held it before. And Patrick helped to get rid of that same said born Caymanian. Now, I need to be fair and I need to be honest. That person is no longer walking amongst the living. So I'm not going to say too much, but by all accounts, that person also did not do the best of jobs, despite the fact that they were a born Caymanian. So being a born Caymanian isn't a qualification. You can't go in there as a born Caymanian and still misuse the public purse. Remember, all the board members are born Caymanians in this instance. And look at all the mess that they were sitting down allowing to happen. So you don't get a pass just because you're a born Caymanian. You should be shortlisted. All things being equal, you should be given the position because you're a Caymanian, a born Caymanian. But that doesn't mean that you're going to get in there and do foolishness and get a pass, especially not from the cold hard truth. Just FYI, in case anybody missed that memo. Miss Lucille, she's so funny. She says, Sandy, why you suspend the man? You cannot see he's doing a good job pointing you back to the Black Friday phone. That's funny. See, he's like, there's that wonderful deal right there from Digicel. Go get it. Oh my goodness. What a mess. Hal, I can think of many Caymanians which are qualified. I agree. To hold that position, we need to take back our island. I mean, I agree. Well, now he's Caymanian, he has status now. And like I said, WRC needs to look into that because, of course, him and the wife not even together anymore. But anyway, there you have it. And of course, although he's at the top, there are many others after they get rid of him, which hopefully their investigations will find all of the nooks and crannies to put it together to build a case for immediate dismissal. Here's a little 1 month severance check. Please be gone. But he's not the only one. Everybody else needs to be held accountable. For example, all the people that he hired that were favoritism, church friend business, and mix up, they should all be gone too. All those bad hires need to go. So the young lady, Candace, that he was having this extramarital rendezvous with, taking her on government trips and spending all that money, she needs to go too. She shouldn't be keeping her job. It's one thing to have an affair with somebody when you're married, he's married. Okay. But it's a whole other thing for this to be at work, in the workplace, and then you're getting promotions and preferential treatment just because you're sleeping with the boss. That's where it's gone too far, Biggs. Like, it's too much. So she got to go, amongst others. And then the little girl there who was, she's Caymanian, but she's in the mix because her father's part of the deacons at the church and whatever mix up. And, she's smoking pot and drinking with them on the job. And she don't show up to work half the time. She don't do whatever. She gets all the passes in the world because she knows where the bodies are buried. So that's why they were giving her the good old pass. Well, she needs to go too. As far as I'm concerned, they should fire most people, then just start over. Start from scratch. Mm-hmm. Della says yes, and we heard about his misgivings. There are many honest, hardworking Caymanians. Maybe I should have said honest. Well, definitely. We need them to be honest, accountable, and hardworking. Yeah. All right. Buenos dias, Canbarantes. ¿Cómo estás? Benny, good morning. Says the old saying goes that you can do as much as you want, but not as long as you want. Hallelujah. That's right, Benny. That's right. Time done run out. What I say? Time longer than rope. Mm-hmm. And his time has indeed run out. Good morning, Sir Anthony. Says, do we have any stats to identify how many status were given through marriage between Caymanian men and women? Have men given more statuses or women marrying multiple times? I don't know. Let me ask how easy that is to get. But I am willing to bet, if I had to just guess on my own, that it is probably the women. Let me see. Do we keep these stats? That's the first question, because one of the things you find out quickly when you do an FOI is one of the biggest problems is nobody's keeping the information. So it's like, what on earth? So yeah. So because no one is keeping the data, they can't tell you it. But if I had to guess, I would be willing to say that there are probably more women given men Cayman status, because I think more Caymanian women are out there looking for a spouse. And of course, can't find a Caymanian spouse, so then they will go looking elsewhere. Mm-hmm. All right, we're off air, so I can read this next question without fear of off-reg messaging me. Marshall says, when you're giving up the pom-pom, you get the preferential treatment. I don't know if they'd message me about the word pom-pom. You think they'd message me about that? Off-reg, would y'all be harassing me about pom-pom? I mean, it's not really a profane word, but yeah, it's a colloquial descriptive word for your private parts. I wonder where pom-pom came from. I don't even know. Where do you think that word, that term came from? It's a bit of a strange description or word for it, don't you think? Anyway, Marshall says when you're giving it up, you get preferential treatment, and that's a problem. That is definitely against all of the rules that are out there. Ms. Della says, yes, they all need to be fired. Dear Lord, when are we going to open our eyes? We have eyes to see what's happening on this island. I'm so sorry. I'm yawning so much. That means that we need to get up and move. We need to get up and do some exercise. And we've not done squats for the past 2 weeks. I have low-key been resting my knee. And I must tell you, this week, it feels really good, actually. It's feeling pretty good. So I kind of almost don't want to stress it. But I do know that the exercising is good for it, right? So yeah, I'm gonna keep at it. But somebody said, nope, that's not profanity, but probably falls under the category of vulgarity. I don't even think it's vulgar, to be honest. I mean, obviously it's a colloquial term to describe your parts, but I can think of a lot more vulgar terms for that. I'm just saying. So I don't know. But boy, they be my apologies. They be doing the most. Yeah, I wouldn't worry about it. I had to chuckle though. I mean, what else could we say that wouldn't be offensive to some people? Vajayjay? That's what my American friends would say. They would say, you're vajayjay. Your vagina. What do English people call it? Do they have a colloquial term for it? I must admit, I'm not that familiar with the English vernacular. But you know, Jamaicans, boy, they can come up. There's a couple on Facebook. This Jamaican, well, she's American and he's Jamaican, and they're married. They're a married couple, and they have the funniest little skits and stuff where, and you can hear that she has been married to him a hot minute now because she's like, she be talking about the Jamaican food and this and that, and she puts her little Jamaican twang in there. You can hear it coming in. But one time they were talking about how Jamaicans describe body parts, and so like they had different words for like chests and just all these things that was so incredibly interesting and funny all at the same time. So yeah. What a mess. I gotta, oh my gosh. Okay. I gotta share one thing with you guys. All right. So, oh my gosh. What a hot mess. If I find their channel again, I'll share it with you guys because I think you will thoroughly enjoy it. It's really kind of funny. And then she'll say it after him. Like he says it with a proper Jamaican accent. And then she says it after him. But like I said, you can tell that she's been married to him for a hot minute because her accent is pretty impressive as things go. But yes, y'all will be just fine. You're buff. That's what English people call it. Oh, that just sounds weird. You're buff. Okay. All right. One Mr. BTF345. What does the BTF stand for? One Mr. BTF 345 says somebody kitty cat. Yeah, that's like what probably the older folks would have called it. Get away and it's causing trouble. That's the song. Yes. Ay. All right. So let's move. Let's keep it moving. Oh my God, America. I don't even want to talk about them, but every day it's something new. Yesterday, I thought we had enough, but look at the latest now, right? President Trump is on a tirade about the fact that the guy last week who did the shooting is one of his own asylum, gave him asylum under his watch. And now he's all butthurt about it and all up in his feelings. And so he's like, we don't want any more foreigners in this country, except for the white Afrikaners fleeing persecution in South Africa. 0 refugees. Oh my God. Woo, America. And then they're like, our forefathers, our forefathers did that. And I'm like, your forefathers stole the land from the Native Americans. Can y'all please stop it? It was not that long ago. America was not built by your forefathers. They came way later. Your European forefathers, Levitt, or whatever the heck her name is, don't really count. Y'all stole the land from somebody else. You're not indigenous to the United States of America. Y'all all came from somewhere. Good Lord. Patter cake? Is that a thing? I've never heard of that one before. Patter cake? Okay. Yes, sir. So we're on a fact-finding mission as usual. And we got a complaint yesterday. And so I'm going to put up this story in full after the after the, oh my God, what the hell? I'm going to show you guys the cutest little video. So yeah, so we got some details on something. So listen, the dynamics of how we are working with the government has changed. I'm going to explain this to you guys because they are much more open, transparent, open to criticism, open to questions, open to queries, right? So, you know, we have questions for them. They are responding. You guys saw, we sat down and we asked questions about the transparency of the planning development, revision and how that process will work. And we asked the questions. We don't give people questions in advance. So, you know, this isn't a situation where, oh, can we have the questions in advance? No. We provide them with the questions. And then, hear me, we don't provide them with the questions. We sit down with them. And in fact, I don't even write out questions. If you ever see me conduct an interview, you will know that I don't go in there normally, hardly ever, unless it's a bit more of a complicated topic and I need to do a little bit of research to understand it myself. But if it's like the average questions that are in people's minds, we just ask the questions. And so this government has been a breath of fresh air to work with. So someone called me yesterday with some complaints about the new crane that has arrived. And they had a whole list of complaints in relation to that. I sent the list to the respective ministry, which would be Minister J. Ebanks. They got back to me by yesterday afternoon with a response to those, and they've clarified quite a bit. So we're going to put the story up there. And I know for a fact, because some of the things that were said, even when I fact checked them myself, I know for a fact that that wasn't actually accurate. Because I had photos and videos showing when the crane got here, for example, right? So we're going to clarify all of that today. So make sure you keep an eye out for that story. So yeah, so that's good. We ask the questions. We get the respective answers, and then we fact check it as well, because just because somebody tells you something don't mean it goes so. We're also going to fact check it on our own. Okay. All right, folks. So bear with me as we get that underway this morning. We're going to be working on that here for you. And I just want to see if there's anything else pressing this morning. So we got a couple stories that we are working on the website. I want to introduce you guys to one of my favorite social media, what do you call it? The kind of the people that I follow that do a really good job of giving you like recipes and stuff that you can follow that are healthier, high in protein, as we start to make these adjustments to our eating habits and our lifestyle. His name, go follow him on Facebook. I just see where he did a high protein sweet potato pie. You guys know I love, I'm not, what's the other pie that mimics sweet potato? Pumpkin pie. I'm not a big pumpkin pie person. I know they're kind of like similar. They almost look the same. Some people claim that they taste the same, but honey child, nothing tastes better than a sweet potato pie. I feel like that's a Southerner in me. His sweet potato pie recipe is amazing. And so I want you guys to check him out because he has a lot of really, really good recipes. And so check this one out. The only thing is I need a recipe to make a bigger batch, but I guess we can just modify it and try to put it together. But look at what he let me show you guys what he does here. And the key to a lot of these recipes, oops, my apologies. The key to a lot of these recipes is actually using protein, like the source of the protein. So you're going to use things like yogurt and cottage cheese, and that changes the recipe completely from something unhealthy to something that's high in protein and so much healthier. So look at this recipe. Does this not look
Mix sweet potato with an egg, sweetener, yogurt, cinnamon, and heat it up. You get a healthy, high-protein sweet potato pie.
Look at that.
If you mix sweet potato with an egg, sweetener, yogurt, cinnamon, and heat it up, you get a healthy, high-protein sweet potato pie.
And you know what you could do instead of that brown sugar, because that's still going to spike your insulin, obviously. The sweet potato is sweet on its own, you know. So you either cut down quite a bit, because that looked like a lot of brown sugar that he just threw in there. You cut down because you're only making one little thing, right? What you can do is you can use other things to sweeten it, like use a banana. So make it like a sweet potato banana pie and do no added sugar at all. But doesn't that look amazing? I just need a recipe to do a bigger batch. I'm going to ask him, how would you modify the recipe for a bigger batch? So that's your keto sweet potato pie. His name is Keto Snacks. Keto, SNACKZ. That's how he smells, snacks. I follow him, and I'm going to put his link here. He does a lot of really amazing recipes. Here's one for doing a creamy, slow cooker French onion chicken. Ooh, la la. That looks delicious. Oh my God. Miss Stacy, I'm sending this one to you. I send Miss Stacy recipes on the daily. 3 ingredient broccoli crust pizza. So you want a pizza. How you do it, cheese pizza, put little pepperonis. You make the crust out of broccoli, because that's where all those carbs are at and the starch, right? So he has some really amazing ways to make certain things healthier. And I love it. Oh my God, he has a Thanksgiving leftover wrap. OMG. With the turkey and everything in one. That looks amazing. All right, I'm going to ask him portions for the bigger regular size pie. Yeah, because I could totally make that really easy. I just want to know. Okay. All right. So I want to modify that a little bit. Okay. That looks fantastic. Good morning, Miss Brenda. I don't make tiramisu. I eat it. Love it. And I eat it, but I don't make it. It's too hard. Tiramisu looks like a lot of work. And there's some people who make it on island that really make an amazing tiramisu. So I just go there and eat it. Child, some of these recipes, I'd be like, 5 hours later, are you still making this one dessert? Don't forget, folks, today is the deadline to get your phone specials with Digicel.
Christmas, the season of love, laughter, and just a little bit of chaos. Sometimes the ham has other plans, and sometimes the road to Christmas cheer feels longer than the 12 days themselves. Was it 3 eggs or 4? Better call Granny. She always knows. And of course, what's Christmas without a little potluck drama? But in the rush and the mix-ups, it's easy to forget what matters most. That's when the magic of connection happens. Because after all, Christmas isn't about perfection. It's about real connection. This Christmas runs on Real Connection. Only with Digicel.
All right. So don't forget the Good Friday sale is still on. Today is the last day to take advantage of all of these amazing options, including for prepaid customers. You get a Samsung A26 for $115, 60% off of the regular price. That comes with a 5-day plan. You also get the Samsung A36 for only $215. And then with that one, you get a 10-day plan included. And then the iPhone 14 for $395. That's a 50% off savings there as well. And that comes along with the 30-day plan. Postpaid customers can get the new iPhone 17, which is an amazing phone. I can tell you from my own experience, with 256 gig of memory for only $9.99. And that's 60% off of the original price of $1,500. And you get the added benefit, if you are postpaid, of having financing options available to you. So Miss Anita says, Sandy, I too prefer sweet potato pie over pumpkin pie anytime. Hallelujah. I love it. So, oh, give me 1 second. This is my other job calling me. Yes, good morning, sir. Lord have mercy. She's the worst. She's worse than you with phones. Well, let me just WhatsApp her. I'll WhatsApp her, but you can be on your way. Okay. All right. All right. No worries. Okay. Thank you so much. All right. Bye-bye. When people don't answer their phones, Lord have mercy. Answer your bloody phone. All right. Okay, honey child. Yes, sweet potato pie is the way to go. So Keith says use honey instead of sugar. They're all going to spike your sugar. So, it's still a form of sugar. I know we think that honey is better for sugar. It might have antibacterial properties and other things, but it's still sugar. That's why I think the doctor, when he was here the other day, and he was like, we were like, oh, can we just put in honey? And he's like, it's still going to spike your sugar. He's still wondering why we believe these things. He's like, it's still going to increase your glucose. I'm like, okay. Smooth Cruise says egg, yuck. Why egg? Because most things you bake an egg with. I mean, there are eggs in lots of recipes, not for nothing. But you can try it without an egg. I think the egg helps a lot of things to stick together. So I don't know if you don't put an egg in there, what it would be like, but you can try it. No harm in trying. Lucille asking about the progress on Noel. Yes, no changes so far. Thank you so much, Miss Lucille, for asking. He's still in intensive care, basically in life support, and peacefully resting, but no significant changes. And we just have to continue to pray. If there's any updates, I will certainly advise and let you guys know of any. So monk fruit. Yes, I understand monk fruit is a little bit better. So he's on Facebook. Let me give you his link here. You guys can click on that and follow him. He has a lot of very interesting recipes. Oh, Anthony. Oh my gosh, you missed it. So last week, Thursday, we did a telethon for Noel because he has been diagnosed with ALS. And, he's requiring a medical bed and some other supplies to try to be at home comfortably. But unfortunately, the very next day on Friday, the power went out and his breathing machine was not on a backup generator or UPS. And so he stopped breathing and went into cardiac arrest. Such an unbelievable and sad story. And so as a result of that, he's now in the intensive care unit at the hospital. We've been asking people to please, the family is dealing with the situation. Please give them time to deal with this. And, so I've been just giving you guys the updates. And so he's basically on life support and miracles happen. So we're all praying for one. And if there's any changes in his condition, I will certainly let you guys know. Very, very sad situation indeed. I couldn't believe it when I heard this on Friday. I was like, oh my God, what on earth? What are the chances? But, if you have these types of machine, folks, please, please, please ensure that you are aware of, if something has to be running 24/7, sometimes the power does go out. So you've got to really just make sure that you have a UPS that gives you at least half an hour or an hour worth of, and then you've got backup generators that will kick in during that time and so on and so forth. Yeah, it's pretty wild. All right. On that note, I think we can end this show there today. Wishing you guys a fantastic Tuesday. Thank you so much for joining the program. Thanks again to Health City for bringing us very educational topics as they do. Menopause is a good one. I have been wondering, what am I going to see some signs? Maybe I'm just not seeing it, but, I'm not going to complain. That's not a complaint because it's a blessing. I think if you reach 52 and you don't even know what a hot flash is yet, right? So I'm all about it. I ain't got no problems going straight through it and not even knowing. I will come out on the other side, hopefully all better for it. So yeah, and I sympathize with those of you because I've actually seen someone have a hot flash and you could literally see her ears turning red and she just becomes like so unbearably uncomfortable. She's like, oh my God, I need to get out of here. I'm like, what's going on? And she's like, I'm having a hot flash. And I was like, whoa, that looks so uncomfortable. So I feel blessed that I don't know nothing about that. And I say, thank the Lord. Hallelujah. And yeah, keep it moving, honey jail. But for those of you who do, reach out to your physicians and reach out to Health City. They now have the clinic there, the menopause clinic, and they can offer you the much needed assistance that you require. And different things work for different people. So that's the beauty of having experts at your disposal. All right, my beautiful folks, thank you guys so much for tuning into the program. Tomorrow, 7:30 a.m., we will be back online. By the way, before you go, hold on. Let me show you what shows are up today. Let me see here now. Because every day we have, CMR TV has launched. We still have some of the content creators that are getting it together still. Let me put it that way. And so they're not all ready. But the ones that are ready, we are kicking it. Yeah, honey, child. So here's what we have on tap for today. This is today's lineup, and we'll post this on social media. Of course, the Cold Hard Truth, which you're just listening to. Then we've got Sabrina Speaks at 5, and then we've got the AI Wave at 6:30. So make sure you tune in for the AI Wave. It's actually a really, really good show. And very, very educational with some heavy hitting interviews in the world of AI. Miss Sue says, lucky you if you get away with them wicked hot flashes. Oh my gosh, I'm so sorry, Miss Sue. So sorry to hear that. All right, folks, please enjoy the rest of your amazing and beautiful day. And tune back in at 5 o'clock for Sabrina Speaks and then the AI Wave at 6:30. All right, have a beautiful day. It's December. Hurricane season is over. We were blessed with no hurricanes. Tomorrow, though, we got to talk about some people who go around scamming or trying to scam other people. And yeah, unfortunately, we got to talk about that, amongst other things. Thank you guys so much. Have a fantastic day.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.